to give a response to a public petition presented on 5th of May by the Speaker of the County Assembly, Makwenu, on behalf of the residents of Makindu Road regarding Makindu Lorry Park and open air market. Yes.
Thank you, Mr. Speaker. The petitioners on Monday next week. Monday next week is when we will visit the petitioners.
And then, when will you present the response?
Immediately after we visit.
Fair enough. Chairperson to a budget and appropriation to give a response to a public petition presented on August by the Speaker of the County Assembly, Makwenu, on behalf of residents of Kalawa Ward regarding an authorized alteration of the financial year 2025-26 ward budget. Chair budget. Chairperson Committee on Budget and Appropriation also. There is another alteration of Kadonzweni Ward. And we have Makindu Ward on budget alteration. I hope those reports are ready.
Honorable Speaker, the reports are ready. Just give me 10 minutes.
We revert to the petitions, the three of them. So, clerk, you don't have the reports? But why are they in the order paper if you don't have them? Now, I'm asking, why are they in the order paper if you don't have them? You don't deal with the committee clerks, you're the committee clerks. If the reports are ready, they should have been the table. I should get a copy. Is the committee clerk and the committee aware that they were to give a response on these statements today at 2:30? So were you supplied with the information? So what were we coming here to do? It is up to you to tell us that you notified the committee, but the committee said they are not ready with the reports. And if they are report, you should have come along with them. Because shuttling is not enough. These are petitions and they are time bound. Next order.
Order number 5, papers.
Leader of the majority party. Followed by Chairperson Budget and Appropriation Committee. You have 2 papers to lay. And Chairperson Committee on Agriculture. There is a paper to lay on the committee's report regarding implementation of agriculture projects in the county. Proceed.
Thank you, Honorable Speaker. I beg to lay the following papers on the table of the Assembly. 1.
Order, Chairperson. You are to update us on petitions.
The petitions, we are going to have a meeting next week on Tuesday, so we are not able to give the report.
Take note that these petitions were presented to you on 20th of August. September, August, first month.
Yeah, very
October,
true.
August,
but
second month.
we requested for a meeting with them.
November, August, third month.
We requested for a meeting that should be held next week on Tuesday.
But the concern is that these are citizens from Kalawa Ward, Kadonzweni Ward, and Kikumini Mubao Ward. Well, not Kikumi Makindu Ward. And they are saying that the budget that we approved was altered. That petition should be considered within or less days. Now, possibly, citizens of Kadonzweni, those of Makindu and Kikumini Mubao, they presume that we are not in support of the allegations, because the truth should have come out. Otherwise, the respective members must be in loggerheads with their citizens because the matter has not been cleared. Member for Kalau, you have a comment? Just a minute. Whip.
Thank you very much, Mr. Speaker. Mr. Speaker, these are petitions that are very important to the citizens of Kalawa. And it is also very important that we get a report so that me as a representative, I'm also able to tell my people how to come or the discussions on the floor of the House. Therefore, Mr. Speaker, it is very important because I remember when those petitions were brought, it has taken quite a while. Therefore, it is also in order for them to be dispensed so that we can have a way forward. And number two, Mr. Speaker, I remember when those petitions were presented, you directed that I also get a copy of the petitions from the clerk, and that did not happen to me. Therefore, Mr. Speaker, it is also good that I get to understand what were the issues because they came, and I'm not aware of what was written. Just a hearsay that there was a petition. Thank you, Mr. Speaker.
So two things. I directed the clerk to share copies of the petitions with you, and the clerk did not. Two, if there was an engagement between the committee and the petitioners, the respective members should be invited. You have not been invited. Now, we are running to December 6 months, we are causing problem. Chair, I met a citizen from Kikumeni Mubao and told me that their member changed their projects unilaterally. And someone called me from Kathonzweni and told me that they are aware that the assembly is supporting the MCA because the MCA changed their budget. And I told them that the matter is before the committee and it will be considered. And then they are bright. They said, the period it is outside. Why are you sitting on it? Because you are siding with the members. I told them there will be explanation as to why there were changes. Assembly has a role in appropriation, there must be a reason. Then he asked me, tell me then the reason. Why did you not just come to tell me the reason so that then we tell others who will be satisfied? Now, where do you leave Honorable Maneno? And what is the damage that is caused against him and between the citizens and the assembly? That is the point. And Honorable Kali and Honorable Kawembe. You know, member for Nzakika.
Thank you, Mr. Speaker. Mr. Speaker, I'm a member of the Budget Committee. I am not very sure whether the Honorable Member for Kalawa was not invited because I believe we dispensed with that matter at the committee level. We also invited Muvao, the member from Muvao, together with the petitioners. We dispensed that matter again. And mostly all the other members. So, Mr. Speaker, I'm also surprised why the response has not been brought to this House, because we dispensed with that matter long time ago. So can we get a response? I'm also for that response.
Clerk, where are the responses? They are in the order paper, and they are not with you. According to Honorable Munyao, the committee resolved the issues. The issues are between your office and chamber. Now, don't tell me committee clerk, because the committee clerk is representing you. So the delay is between your office and the chamber, because you don't expect the chair to come carrying their documents. They must be supplied with the documents.
You can check on the date when you dispense with that matter. It's a committee. It's a long time.
May I get a response in the next 5 minutes? Clerk, you withdraw from the chamber and get us an answer. If the committee adopted the issue, then you need to find a way of organizing your office. Chairperson, Budget and Appropriation Committee, or the leader of budget. Yes, proceed.
Thank you, Honorable Speaker. Honorable Speaker, I beg to lay the following papers on the table of the Assembly. 1, the report of the Auditor General on Makueni County Climate Change Fund for the year ended 30th June 2025. 2, the report of the Auditor General on Makueni County State and Public Officers Car Loan and Bondage Fund for the year ended 30th June 2025, County Government of Makueni. 3, the report of the Auditor General on Tower Sub-County Level 4 Hospital for the year ended 30th June 2025, County Government of Makueni. And 4, the report of the Auditor General on Kisau Sub-County Level 4 Hospital for the year ended 30th June 2025, County Government of Makueni. 5, the report of the Auditor General on Boni Sub-County Level 4 Hospital for the year ended 30th June 2025, County Government of Makueni. I lay.
Honorable members, the reports of the Auditor General stands committed to the Committee on Public Accounts to consider and report to the County Assembly pursuant to Article 229, sub-Article 8 of the Constitution of Kenya 2010. Within 3 months, a report should be submitted to this House. Chairperson, Budget and Appropriation Committee, you have 3 more papers to lay. 1 is on budget implementation report by the Control of Budget. The other one is Makueni County Financial Year 2025-2026 Annual Development Plan. And 3 is Agriculture County, no, that is for Committee on Agriculture. Proceed. Budget and Appropriation Committee.
Thank you, Honorable Speaker. Honorable Speaker, I request for more time. The reports are not ready. We will submit in 7 days.
All the papers.
Yes, they are not ready. We only have half-yearly progress report.
The Annual Development Plan.
Not ready.
We conducted public participation. The ADP has a timeline within which it should be approved, and that is it September? Submission is September, but within, I think, 90 days or thereabout. There is no any given time we have ever, took a break for Christmas without an annual development plan. Something is wrong, Chair.
We are expecting to adopt the report in our next sitting.
Now, what do we do?
Give us more time.
More time is February. Imagine county government of Makueni approving annual development plan in February. In February, we'll be dealing with physical strategy paper. When we resume midweek, the second week of February, Waziri will present. So what is pending?
The HDP is still pending.
No, we conducted public participation.
Yes.
Report writing.
Yes.
So what's pending?
You need to adopt the report.
You have quorum.
No.
Member from Ga is here.
You're only 4 of us.
And the quorum is?
You can donate 1 member to us.
It is not possible. Strictly speaking, what you'll do, you have to source a member even if it's from home, so that before 5 honorable members, we have to approve the annual development plan. Sorry?
You direct so.
You can't be. What's your point of order?
Honorable Speaker, it's concerning that last time I checked, we never used to allow committees to sit during assembly days. The Committee of Devolution has whipped members to Machakos. That is why some of the members of budget are missing, including the chair. He's a member. So, Honorable Speaker, this should not be allowed in future. Thank you.
How many members are in the Committee on Devolution? There are 11, less 48. That is, where are the 37 members?
The Speaker, it is very wrong for a member to demonize a specific committee, because even herself, when she's leading the Committee of Gender, we allow them to be away when we are still here. The reality is the lack of quorum in the floor is not related to the Committee of Devolution. I'm a member of the Devolution Committee, and I'm here, I've organized because there was specific business to be handled by the Devolution Committee. So this context is not here nor there for a member to stand and start demonizing a specific committee. Thank you, Mr. Speaker.
Don't worry, I know when we will get a request for Committee on Gender to sit throughout the plenary. Honorable Mutinti will not leave my office. And she will not refer to me as a speaker. She will call me by a nickname so that I may consider the approval. Nevertheless, honorable members, my concern is we have the Makueni Care. 2, we have the annual development plan. Now, explain to me why we should and how we will proceed without annual development plan to resume in February, when we'll be expected. And you know the Minister of Finance must use the approved annual development plan to prepare the county fiscal strategy paper to present in February. And unless then you will have a special sitting. You will alter this calendar to sit on Monday. The annual development is a do or die. Order, member. We have been in this house, and this is a serious business for the people. As to whether the committee had quorum or not, it's not about the committee. It is that, explain to me how you will go to Lima without ADP. And the fiscal strategy paper, public participation by executive, cannot be conducted in January because the minister doesn't have ADP. Otherwise, what I will do, I will then gazette will resume any other time next week, a special sitting, which is not necessary. Can we determine that now? Yes, majority, and then Mheshimiwa Francis.
Thank you, Mr. Speaker. I think we can have a meeting online, and then we resolve that matter immediately. Because there's only one member is missing.
Is the report ready?
Sorry?
All you require is adoption of the report.
Yes, I believe so.
Clerk, update me on that matter in the next 1 minute. Consult the committee clerk as to what is pending on the ADP. ADP. Okay, Honorable Francis, what I'm getting is different.
So you do whatever you want.
Honorable members,
Why are you rude?
I have consulted Honorable Kalunda, resume my seat. Honorable Mudhoka, resume my seat. Now, honorable members, we have to make our decision. I'm picking the following. Let's be orderly. We need to put our house in order. The Budget and Appropriation Committee had last week to deal with the ADP. We interrupted the business of the County Assembly to attend to CASA. So we took away time for the committee and for the plenary to do some work. At the House business then, it was proposed that we take away and adjourn, what a member for Elima. And we adjourn to attend to CASA, but compensate that time. Now, I'm aware that the Budget and Appropriation Committee, you require to physically meet the executive committee member, and even sectoral committees have not given their responses. Now, it is not practical for us to again adjourn without approving the annual development plan. As it is a practice, I've consulted the leader of the majority and the leader of the minority, and they are not agreeing as to whether we will adjourn or not adjourn, extend to sit next week. But since they represent members who are seated here, I will open floor for views by members, because we need time to consider the statutory requirement of the ADP to be approved. We cannot not have it. And we consumed time for this business and for the ADP ourselves. That's why the Budget and Appropriation Committee could not meet and engage the executive committee member, because it's not just a committee sitting, it is under serious meeting to consider the views of the citizens, to be considered based on finance and report is tabled. The floor is open, members on contribution as to whether then we'll meet to alter the calendar to sit next week in line with the regular session sitting time. That is Monday afternoon, Tuesday morning and afternoon, Wednesday afternoon, with Monday morning as committee sittings and Wednesday as committee sittings. Take note that we may also not have other committee sittings within the month of December. I'm aware members also you would want to, you have a program to retreat, but that program also may not consider the committee sittings also, as indicated, because there is an activity for the committees, for staff training that is taking. But that aside, let us consider views on altering the calendar to sit next week. Floor is open. Honorable Elizabeth.
Honorable Speaker, I rise to oppose that we extend the extension, because as the Committee on Special Interest Groups, we have an invitation.
When is it?
From Monday.
From Monday to when?
I think it's 3 or 4 working days. Honorable
Can I get clarity on that? Proceed.
We are supposed to travel on Sunday. However, Honorable Speaker, committee sittings, we can still do them while we retreat in Mombasa, because we agreed in Liaison.
Honorable Elizabeth Mutindi, you're missing the point. You're debating on annual development plan. You are telling us to resume in February to adopt the annual development plan.
Oh, sorry, we can do the special sitting in one of the days during the recess. Thank you.
Honorable Gali.
Thank you, Mr. Speaker. Mr. Speaker, I do agree with the member, Honorable Mutindi, that we can find a day, the course of next week, you have a special sitting. But having that point, Mr. Speaker, it is very important to note this. The Budget Committee, and for this matter, I know that we have an able chair, but our chair who is taking this assembly into circles. I remember, Mr. Speaker, when we were passing the supplementary budget, it took us time. And the member from Zakeka stood with this assembly. But the chair took us on circles. I remember when we were at MBC, Mr. Speaker, on Monday, that a communication came that the budget committee is ready to meet Waziri and have a discussion. Right from Monday, today is on Wednesday. Early in the morning, when we were at MBC, the other communication also came again that the budget committee is having a meeting with Waziri. Why are those meetings postponed? Is it a deliberate action that these members can be taken to circles? That is what we cannot allow, Mr. Speaker.
Okay.
Therefore, Mr. Speaker, as we consider to have that special sitting, it is very important for the chair to take seriously matters of this assembly with high concern. Where is he now? He's somewhere hiding, I don't know where. Thank you, Mr. Speaker.
Honorable members, we have two things. Why we are discussing annual development plan, because it is beyond Budget and Appropriations Committee. It's a government policy paper. Honorable Kali, if we start the case, it's not going to answer us. We now want order. Let me guide you. Let me guide you, Honorable Kali. Now, we will have an opportunity, when we make a decision, we have an opportunity to deal with that matter, including reorganizing that. Now, we're asking ourselves as an assembly, when can we sort this matter, and then we work backwards to address what you have said. Now, the problem is this. You have debated. Now, Honorable Gali, it's not easy to be a speaker. I'm telling you, between us and county government of Makueni is an ADP. It doesn't matter who is right and who is wrong now. But after this, we can deal with who is right and who is wrong. Let us agree, the purpose of this debate is that we are seeking how do we expend the time for the county assembly, not the committee, to consider as now we deal with the issues that you have raised. Please, if you help me arrive at that decision, it will be useful.
That is very good, Mr. Speaker. I do agree with you. But I tend to see the chair for budget is not a serious person.
So what do you want us to do?
We had 3 petitions from the wards. The committee said the members agree that they discussed those petitions, but the chair is nowhere to ensure that the report comes to this house. That is very bad, Mr. Speaker.
Honorable members, I don't know whether I'm alone in this. Yes, but please, let us not argue about who was right, who was not wrong. The matter is now before the assembly and the people of Makueni. We will deal with those things separately, even in Akamukunji, so that we get to know why the chair misled, and I will deal with that, and I can open another floor. Can we know how to resolve the annual development plan, or allow me to make a direction or an advice? Honorable Mbalu.
Thank you, Mr. Speaker. I get what you're saying, and it's really very important that we cannot now start blaming because we need a solution. We need a solution and way forward. And so we must make a decision about having a sitting next week so that we can be able to handle that. I understand there are those who will be going out, but I believe if the Committee of Budget can lead in this, would not have problems with the even quorums. And I believe, Mr. Speaker, if we can decide.
To sit next week?
Yes.
How many days?
Even if it's 3 days or 2, we can decide and finish it because. And Mr. Speaker,
Thomas,
the other point is, I would wish that you lead from the front that the ECM of Finance sees the seriousness of it also. because, Mr. Speaker, if the committee wanted to meet and the ECM finance was not able, that is not good. We must find, there must be that urgency. This weekend, we have a sitting with the finance. Yes. Not next week, this week, so that by next week we'll have everything set. Mr. Speaker, because now, since we have limitation, we have timelines, and these timelines now must be followed. So the ECM should be able to meet with the committee this week.
Thank you.
Next week you finish.
Honorable members, leave the timelines with me. I will enforce and I'll give directions. Honorable Elizabeth Mutindi, you're traveling on Sunday. We have an ADP. Can traveling on Monday be an option and still cover that day, the day after, so that you still have the days for training, especially elect members, but have a day to extend to sit next week on Monday, and then you travel on Monday. That's a matter for consideration by special elect members as we discuss. Let me hear Honorable Munyao. Then
I oppose the extension because, Mr. Speaker, I feel that if we do that, Monday we may not get the members in this assembly. Given that we have already made some decisions at Liaison and other venues. So, Speaker, my feeling is that we just spend this matter because, you know, the problem with ADP is that we have to consult with Waziri. She has been taking us into circles. So what will change between now and Monday?
so we can deal with it in February.
Yes.
Thank you.
Yeah. That's my conviction.
No, I hear your comment. You are entitled to it. So that there will be no PP in January for fiscal strategy paper.
Mr. Speaker, once we go to Mombasa, because we will be on a working retreat, we can handle some of these things there. And then once they handle at that level, together maybe with Waziri, because she might be even willing to join us there, we'll have very easy time. We would set a date and come and pass the ADP. We have no problem. Any day, you gazette it and then we will come.
Yes,
But not Monday. Because
Okay,
Monday,
I hear you.
I think you are already set.
I do not want to extend blame to the county executive. At the moment, the blame is resting with the Committee on Budget and Appropriation. So I'm just clearing a matter. This is not a platform for the committee to cleanse itself. The issues and the complications they are raising, they should have raised them before. For now, we know the Committee on Budget has not been able to process a report before us. And therefore, we take your comment any other time, but not next week. Leader of minority and then leader of majority. But before then, there is Honorable Katumo, leader of minority and majority.
Thank you, Honorable Speaker. Honorable Speaker, I stand here to make a suggestion that we extend the adjournment to next week. To next week on Wednesday, Honorable Speaker, so that we can deal with the NDP. But Honorable Speaker, as members, and also on Monday I said something about the leadership of the committees, Honorable Speaker. Honorable Speaker, when we were elected and came to this assembly, Honorable Speaker, everybody knew what he's coming to do in this assembly, Honorable Speaker. Honorable Speaker, we did the public participation on ADP. And the people of Makueni, we told them we are going to pass that report when we come to this assembly, Honorable Speaker. We have been here for more than 2 weeks since we did so, Honorable Speaker. Honorable Speaker, we have not done what we are supposed to do as members. Mheshimiwa Speaker, if the committee has an issue with the Waziri, I don't know how we are going to assist them, Honorable Speaker. One of the committees, Honorable Speaker.
I'm not aware. If there was a problem, I would have known.
The issue of meeting. Honorable Speaker, one of the committees which has a lot of business to do, Honorable Speaker, is the committee on PAC, Honorable Speaker. But anytime we need to engage the Waziri, Honorable Speaker, the chair makes sure that we meet the Waziri, Honorable Speaker. It is time now, Honorable Speaker, because we are coming to the end of our term, Honorable Speaker. We need to give the people of Makueni what they deserve, Honorable Speaker. Pushing this report to next year fair, Honorable Speaker, we are not doing justice to the people of Makueni, Honorable Speaker. So, my Speaker, I suggest that next week we meet, but we need to be assured that as we become into this assembly, we will get quorum, Honorable Speaker, from the leadership of the majority and the minority side, Honorable Speaker. And the leaders of this assembly, in both sides, Honorable Speaker, they should take this business very serious. Honorable Speaker, we have come here for several, we have met here on several occasions, Honorable Speaker, and lack quorum because of the leadership of the House, Honorable Speaker. From the majority side, mostly from the majority side, Honorable Speaker. And Honorable Speaker, we need to take this business very serious. Thank you.
Member Fumuka, please don't take us to what budget committee has been able to do, not to do. We don't want to get to that. You don't defend. We just want to see how we can sort the matter. Please. Yes.
Thank you, Honorable Speaker. Honorable Speaker, I am not defending, but it's good for us to know where the problem is so that we may be able to move forward. Honorable Speaker, one, it is not an issue of budget committee. I want us to understand that as an assembly. And that's why even you indicated that once the ADP was tabled to this assembly, it was committed to sectoral committees. And that is why we are, Honorable Speaker, that even most of the sectoral committees have not given their reports. And that's why you indicated last week, committees were supposed to handle the ADP, the sectoral committees did not process their reports. So that is where we are, Honorable Speaker. First, we need to digest the sectoral committee reports on the ADP, where a number of them have not submitted. And thereafter, because it's procedural, Honorable Speaker, that's when the Committee of Budget is supposed to have a consultative meeting, Honorable Speaker, to discuss those issues that were raised by the Budget Committee and the issues raised by the sectoral committees, Honorable Speaker. Secondly, Honorable Speaker, it's in my very humble opinion, where we are, because Honorable Speaker, we need to handle it procedurally, as I have indicated and you indicated earlier. It is fair for the Assembly to agree for us to gazette a sitting day. Thereafter, we may be able to process this document once all these have been finalized. That is my take.
Leader of the minority party.
Thank you, Honorable Speaker. Honorable Speaker, the core business of this assembly is to pass laws. And in the business of passing laws, other things may happen in between, like going to CASA games, sometimes doing some retreats, Honorable Speaker, and others. But the main role is oversight, representation, and legislation, Honorable Speaker. We have two legislative items in front of us. One is the ADP and Mutula Care. Honorable Speaker, I have not seen the commitment to do these two major businesses. So it is prudent that we extend this assembly up to next week, Wednesday. And it's not about extending or having choices on whether to come or not. We saw to defend the Constitution of Kenya and also to represent people of Makueni County. Now, Honorable Speaker, we borrowed some time going to Meru to do the CASA games. We were deemed to be here, Honorable Speaker, but we didn't because we had the luxury of changing dates for ourselves, Honorable Speaker. It's not like it's a national exam and it is fixed. If there are new items and new emerging issues, Honorable Speaker, we cannot move away from that, Honorable Speaker. That's why this assembly has the latitude to change even the calendars, Honorable Speaker. And the only way to do it is to change the calendar to accommodate the week we lost in Meru. And it would not lose, I said. We only changed the calendar. The agreement was we will compensate that time when we come back in December. Two, it will also help us in claiming some of the benefits, Honorable Speaker, in this assembly, in terms of showing the public that we are able to do our job, even in extreme circumstances and environments, Honorable Speaker. So that is what I was employed by people of Kikumbulu South to do for them, work even at night when I'm expected to do the work for my party and my coalition, even when it is very unfair for me, Honorable Speaker. So I wish members you can agree, one, to extend these sittings up to next week on Wednesday. Two, Honorable Speaker, I have heard also the Mutulakya was supposed to also be passed by this assembly. I didn't hear the Committee on Health saying they are not able to move because they did not sit with the minister. You did not sit with the minister. Honorable Mbalo did not sit with the minister because the minister did his job as we do our job. The work of this assembly is not dependent on, is not dependent on the executive because they send our reports here officially to the clerk of the county assembly, who is the custodian of all materials for this assembly, Honorable Speaker. So the moment the minister sent the ADP report and we took it, we subjected it to public participation, Honorable Speaker, we do not even expect the Committee on Budget to force the minister to go and sit, to have a sitting somewhere, Honorable Speaker. I have seen and I have listened to mamas around here, Honorable Speaker. Members of the assembly are saying the Committee on Budget has been delaying some of the businesses because they want to go to retreats with the minister, Honorable Speaker. We will not allow that. Let that business be brought here even without having a sitting with the minister. And that way, our role of legislation will be felt, Honorable Speaker. I don't want to speak a lot, but that is the procedure. The procedure, I have listened to my colleague, Honorable Mwema. He is speaking to procedures. Some of these procedures are just the convenience of the assembly. It is not in the Public Finance Management Act. It is not in the County Governments Act. It is not in the Powers and Privileges Act. It is only for the convenience of this assembly and the presidencies we've set, Honorable Speaker. If today we feel we don't need to have those conveniences, Honorable Speaker, the moment the minister places the same to the committee, the clerk, Honorable Speaker, and it is tabled here, Honorable Speaker, we don't need to consult anybody. We just need to come up with our report, an independent report. The County Governments Act expects county executives and county assemblies to be independent, but to listen to each other. So unless the minister now has some issues, burning issues, to say, before you pass the ADP, please, I need to have a sitting with you, as we are legally placed to pass that ADP without the intervention of the executive committee member for Treasury, Honorable Speaker. So that is my point. We extend the sittings, and when it comes to the extension, Honorable Speaker, of the sittings, we are not coming here to dictate when we have the committee sittings and when we have the plenary sittings, Honorable Speaker. We want the assembly to compensate the work which was never done when we were doing the sports, Honorable Speaker, in Meru. Of course, we are very proud of what we did in Meru. Like in my discipline, where you play, Honorable Speaker, so we won the gold medal for the handball.
Your point is made,
Honorable Speaker, where you scored a very spectacular goal, Honorable Speaker.
Your point is made.
Honorable Kali was a great defender. Thank you, Honorable Speaker, and I wish we do the same. Thank you, Honorable Speaker.
Thank you, Mr. Speaker. It's very interesting that my leader wants to have both the positive and negative at the same time. The Speaker, I'm pleading with this House, and after going through and listening, there are critical issues which are very key. Mr. Speaker, if you remember in our platform, which includes all the members, there's been a discussion going on when we can be able to sit and have our sittings. I believe nobody was expected to come here on Monday or to do their committee sittings while at home on Monday and Tuesday. Members were very free. The Speaker, where even I saw you commenting that we can have our sittings, we can have our committee sittings on Monday and Tuesday. The Speaker, I'm thinking, instead of incurring another cost of advertising or of gazetting and day of sitting, since members were unitarily in agreement that they can do their committee sittings on Monday and Tuesday, we can combine and we kill two birds with one stone. Whereby we come on Monday, we have our sitting, and then we do our committees the same day. We also will come on Tuesday, we have a sitting and do our committees at the same time, and that avoids the expense of gazetting an extra day, of going home and coming back here again, it will disorganize us, and these are the time of festivities. So I would urge members, and I would wish to request members, that we sacrifice. As leaders, we can sacrifice, and we do our sitting on Monday and a Tuesday while we do our committees, and that helps us to solve 2 issues which were raised in liaison at the same time. I wish the clerk would sit down so that Mr. Speaker can listen to me. You know, men are not blessed to my task. Ladies are blessed to my task. So in this context, Speaker, I'm saying, the same way we sacrifice for our own people, because NDV is very critical. And I will also echo the words of the minority leader that once the report was prepared from executive and they come to this table, it means they have done their part. It is us now to interrogate this report, and we don't even need the ECM back to sit with us. So the budget committee should get out of the loop of saying they need to sit down back again with the ECM, unless she raises issues concerning the report originating from our office. Ours is to compile, go through the report, bring it on the, in the House, and then once we agree, it goes back to them. Last point is that, Mr. Speaker, there's nothing which is more important than the budget. And the NDP is the starting point of the budget for next year. If we interfere with it, this like a chain, it will interfere with the physical strategy paper, it will also interfere with the public participation days, and we don't want people to hide behind the county assembly and say it is the county assembly which gave us this document late. So can we, kindly members, extend to Monday and Tuesday? We do 2 things, committee sittings, and we do handle this matter and finish up the matter. Thank you, Mr. Speaker.
Honorable members, where we are, we may not do much. We don't have quorum to take a decision on that matter. I am usually very careful. I had to bring this matter for you for determination to make that decision. Otherwise, the Speaker would have been deemed not to have advised members that there was important business for them to consider, and I allowed them to proceed on recess without informing them. That was to be on my doorstep, but it's up to us. But since it is not in the order paper and it's not ready, and I can get the feel that the special elect, you have a business to consider, which is more important, but ADP can wait. I am persuaded you would have still traveled on Monday and consider the ADP on a Monday. If, again, we care about this. I still feel that the Budget and Appropriation Committee between now and Monday next week, they would have resolved the reports and would have approved it. But that doesn't seem to be the mood. So I don't have to take a decision. And I cannot compel committees to do what they're supposed to do. In the circumstances, then we just follow the order paper as it is. And should you want to move a motion either majority and minority, you are for 2 days, majority, minority is for 3 days. Should you want to move a motion, then the clerk is available to draft one for you. All you need is to agree is whether it's 1 or 2 or 3 days next week for consideration of that pending business. And I'll put the question. So clerk, you may assist the majority and minority, they're in concurrence. And for members will decide. Meanwhile, we have a business, important business to undertake, which is in the order paper, and this is Makueni University of Care. Next order. Honorable members, I have confirmed that the Budget and Appropriation Committee on Kalawa, it is yet to meet the petitioners and MCS. Clerk, is that the position? Budget and Appropriation Committee, since from October, with a lot of respect, you have not had time to invite the petitioners and the respective MCS to discuss on the response. And therefore, the said responses to petitioners, the responses are not ready and far away from ready. If Kalawa has not been invited and people, then we have a problem. Perhaps we will deal with it in February. Next order. Chairperson, Committee on Agriculture, to lay a paper. Chairperson Committee on Agriculture, to lay a paper.
Thank you, Mr. Speaker. Mr. Speaker, I beg to lay the following paper on the table of the Assembly. On the report of the Committee on Agriculture, Livestock, Fisheries and Cooperative Development regarding the implementation of various agriculture projects in the county.
Next is the chairperson for next order.
Order number 6, notices of motion.
Chairperson Committee on Agriculture to give a notice of motion.
Thank you, Mr. Speaker. Mr. Speaker, I beg to give notice of the following motion that this Assembly adopts the report of the Committee on Agriculture, Livestock and Fisheries and Cooperative Development regarding the implementation of various projects in the county, laid on the table of the Assembly on 3rd December 2025. Thank you, Mr. Speaker.
Next order. Next order.
Order number 7, statements.
Honorable members, for convenience of the House, I direct that we reorganize the business to proceed with the motions. Next order.
Order number 8, motion. The report of the Committee on Health Services on the Makueni County Universal Health Care Coverage UHC Implementation and Guidelines 2025.
Chairperson Committee on Health Services, I do not want to allow you to get into bush. You read a motion, by the time of proposing second, we find there is no quorum. But we know from the leadership in the House whether we have quorum to transact this business. We need 4 members, they were present. Leader of the majority. The majority said at 4 members, they have exited. Where are they? The majority side, there is a business of the government in the House. Sergeant Atam, you ring the bell. Majority Whip, Minority Whip, Majority Whip, Minority, we will not get quorum.
SHA registration promotion. The strategic approach of the program employs a dual strategy of county-sponsored shift premiums for indigent households unable to afford contributions and massive mobilization campaigns to register all residents into SHA. Beneficiaries will receive comprehensive health care services through the Primary Health Care Fund, Social Health Insurance Fund, and Emergency Chronic and Critical Illness Fund. Makueni County faces significant disease burden from both communicable and non-communicable diseases, with the poverty index of 44.7%. Many households risk catastrophic health expenditures. The county demonstrates strong maternal and health indicators, 92% skilled delivery, 76 with the plus 4 ANC visits, but struggles with conditions like upper respiratory tract infections, that is that 303,595 cases over 5 in 2024. Hypertension has 76,108 cases, and diabetes has 25,021 cases. The program utilizes a cascading training and implementation structure involving steering committees, county coordinators committees, sub-county committees, ward vetting committees, and over 6,000 community health promoters and community resource persons. A sophisticated ICT integration system will enable real-time monitoring, beneficiary management, and data-driven decision-making. Sustainability mechanism. 1, ring-fencing at least 10% of health facilities share reimbursements. 2, progressive budgetary allocation. 3, partnership mobilization with development partners. 4, mass registration drives to expand the risk pool. The program is grounded in constitutional rights to health, supported by the Social Health Insurance Act 2023, County Governments Act 2012, Makueni County Health Services Act 2018, and guided by the Makueni Health Policy 2020 and Social Protection Policy 2024. The major rationale for Makueni UHC is that county-led program can directly identify vulnerable households through community structures, ensure targeted subsidies, and leverage local knowledge and experience, accelerated UHC outcomes, and bridge gaps in national framework while complementing SHA. Public participation report. The County Assembly, through the Committee on Health Services, conducted a public participation on 20th and 21st November 2025 across all wards to validate the public participation report submitted by the County Executive as the law requires. The County Assembly was divided into 15 subcommittees to undertake the validation exercise, and reports received from each subcommittee, which were consolidated into one report, taking into consideration the proposals from the public as outlined in the main report and formed part of this report. Stakeholders submission, Makueni Community of Practice. The committee received detailed memorandum from Makueni Community of Practice dated 21st November 2025, representing over 300 civil society and community-based organizations in the county. The submission addressed 2 key documents under consideration, but this committee only considered the submission of the Makueni Universal Health Coverage Implementation Guidelines 2025. The committee considered the memorandum and incorporated the issues in this report by word of recommendation. Observation and findings. The following are the observation and findings of the Makueni UHC guideline. 1, the Makueni UHC guideline have strong legal and policy foundation, being anchored on the Constitution of 2010 on the right to health and social protection. 2, the Makueni Universal Health Care Guidelines have a clear alignment with the national SHA structure while maintaining county autonomy. 3, the Makueni UHC guidelines have a robust community-based implementation model with community health structures of over 6,000 CHPs and CRPs. 4, the county has gained notable experience from the pilot program of 2016 to 2022, having understood and the adverse selection challenges and strategies it has come up with to bridge the gap. 5, the Makueni UHC guidelines are strongly technologically integrated the digital beneficiary registration system, real-time monitoring dashboard, and on-offline capability for access with the poor connectivity among the ICT integration strategies. 6, the Makueni GC guidelines have a clear indigence identification methodology using the proxy means test for objective scoring. 7, the program has a comprehensive health benefits package and sustainability mechanism built on. Recommendations. The county government should continuously strengthen financial sustainability by ensuring timely reimbursement from SHA and establish clear escalation mechanism for delayed payments, ring-fence and enforce the minimums of 10% facility reimbursement allocation to UHC, and seek partnership with NGOs, private sector, and development partners for additional financing. 2, the county government should continuously improve community mobilization and SHA uptake by the undertaking countrywide sensitization through churches, markets, radio, and chief barazas, intensify digital literacy campaign to support mobile-based SHA registration, provide regular facilitation and supervision of CHPs to sustain high registration rate, and strengthen collaboration with NGAO to fast-track national ID issuance. 3, the department should ensure strict application of the proxy means test to prevent abuse and ensure only genuine indigents are included during selection of indigents. Ward vetting committees should use transparent, validated processes, including public display of lists, provided training for committees on how to avoid political interference or bias selection. Conduct annual review to update the indigents register to remove duplicates, migrated households, and deceased persons. 4, the county government should always enhance service delivery quality by prioritizing investment in primary health care level 1 and 3 to reduce unnecessary referrals, strengthen shock management, and reduce facility level shortages of essential health products. 5, the county government should ensure there is increased budget allocation for Makueni universal health care coverage in the subsequent fiscal years to ensure a bigger number of citizens benefit from this program. 6, the Makueni universal health coverage implementation guidelines should be reviewed after every 3 years. 7, the county assembly approves the Makueni universal health care coverage implementation guidelines 2025 with the following amendments for implementation by the county executive. 1, that the ward vetting committees be realigned to replace ward development officer with ward public health officer, who should be the secretary of the committee. 2, the sub-county coordination and ward committees to be realigned to ensure at least 1/3 of governing board seats reserved for non-state actors for purpose of public representation, CSOs, community reps, and professional associations. Mr. Speaker, I request Honorable Mateso to second this motion.
Yeah, thank you, Mr. Speaker. Mr. Speaker, I stand to second this motion, Mr. Speaker. And I urge members, this is what we have been waiting for our people, and it's only prudent we pass this motion. Thank you, Mr. Speaker.
Honorable members, I propose the question of this assembly adopt the report of the Committee on Health Services on the Makueni County Universal Healthcare Coverage, UHC, Implementation Guidelines 2025 laid on the table of the Assembly on 2nd of December, year 2005. Floor is open. Proceed, Leader of the Minority.
Thank you, Honorable Speaker. Honorable Speaker, I stand to support this motion. Honorable Speaker, to also acknowledge the Committee on Health. They have been able to report to this Assembly very seamlessly. on this matter, and also the bit where they brought the public participation aspects very clearly, Honorable Speaker, and I was privileged to be part of the public participation. People who are contributing to the same Honorable Speaker in Kikumbulu. Honorable Speaker, we have been waiting for this report for a long time, and it is time. We appreciate the efforts of the committee led by Honorable Mbalo with what they have come up with, except for some of the issues where, because when you look at the model of share shift, in our places, we normally pay sometimes out of pocket for our residents in our wards. Like in Kikumbulu South, we normally pay for patients at Hamref, because normally they can only pay when they are admitted, Honorable Speaker. I was requesting the same model can be used here so that we don't have a lot of shortfalls in terms of paying for people who will never be admitted to the hospital, Honorable Speaker. And that is allowed in chair. Maybe with other models like NHIF or other insurance schemes, Honorable Speaker, that may not be practical, but we've been paying for our people immediately they are admitted in hospital. And from that moment, you are able to be paid up to the amount they are expected and the limit. Having conditions, some health conditions, Honorable Speaker, but still they will not be admitted in the hospital, Honorable Speaker. So the bit to do with this Mutula Care, for it to have the impact, for it to really help the communities, Honorable Speaker, if the Honorable Chair can look into this and have a good agreement with the Minister, because I explained to the Minister some time back when we met, and she was hesitant that share shift will not allow the county government to pay on demand, Honorable Speaker. But I told her she should explore further to get these facts, because that is what we've been doing on the ground, Honorable Speaker, where we can avail some float at the Chief Officer's office, Honorable Speaker, and the moment people come into the hospital and they will be admitted, there is a choice between paying the whole amount or paying some part of the amount, Honorable Speaker. When you look at, because I have seen there is a vetting committee, I don't know at what level, but that vetting committee can also help us not to pay the whole amount, because some of the patients will come and then they don't need to be given a full attention, Honorable Speaker. They may be lacking like 2,000 shillings. Yes, they are fundable because they are Makwen people. But with this vetting committee, we'll someday pay for all the patients, Honorable Speaker, and patients who will not be availed in a level 4 hospital, Honorable Speaker. So those are the matters I wished the committee can help us with. And also the chair, who is a specialist and a long-term expert in medical world, Honorable Speaker, with insurance also being a major for him, Honorable Speaker, that will really help the people of Makweni. So that is my argument. I hope members can also see this happening. My elder Honorable Mangangi, my neighbor, I can see he's nodding. The same with Honorable Mbalo and others. I understand, because they are always on the ground. They are able to see, even with our ward kitties, because some of us have put some monies to help our people when it comes to these vulnerable cases, Honorable Speaker. The same can happen. Because when somebody presents in a hospital, Honorable Speaker, and we are paying up a certain amount, they have a bill of 10,000 shillings. But sometimes when the social workers and the officers from the county visit or take time to assess this patient, he may not qualify for 10,000 shillings, but he may qualify for some part payment, like 5,000, 4,000, depending on how they are presented, how their homes look like, those kind of things, Honorable Speaker. So the same case should happen with this social health insurance fund, because there is no capitation which is going to come back if we pay and then people don't come to the hospital. So the benefit is, Honorable Speaker, when we pay for 18,000, as we have heard from Honorable Chair, we may pay for 18,000 people, 1,800 people, or 18,000 people from the wards, Honorable Speaker, and we will not be able to even get some reimbursement from 1,000 people, because all of them, their time will expire. That 1 year, which you are paying for them, may expire without them having to visit a level 4 hospital. And now that the government is able to dictate that level 3, 2, and 1, you can be treated without paying the fees, Honorable Speaker, we can take advantage of that. We pay for only people who will be admitted in those hospitals. And that way, we will save the money, we will reimburse the kitty, we will replenish the kitty, and in the next phase, Honorable Speaker, by the time 2027 approaches, Honorable Speaker, within a ward, we will have like 5,000 people benefiting from this year Mutula Care Card, Honorable Speaker. It's a good thing. Even those people want to be recommended to go to other hospitals outside Makueni, they will really have a good kick, Honorable Speaker. If you are going to see a specialist in Mombasa, in Machakos, in Nairobi, you can still benefit from this card, but being assessed and being ascertained that you will be admitted in this hospital, Honorable Speaker. So it's a brilliant idea, but this brilliant idea, we need to put some more weight, some more meat into it, so that it helps as much as possible, and we don't come back here in 2026, Honorable Speaker, during the budget making, to add another 100 million or 95 million shillings. That 95 million shillings should be reimbursed through the rebates which will come from share shift, Honorable Speaker, and that will help the people of Makueni, and all of a sudden, this card will be more sustainable than any other card, because they will be able to pay for themselves, and the next person in queue will still gain the same. We had a sitting, Honorable Speaker, I want to finish. We had a sitting with Dr. Laiposha. Dr. Laiposha.
Order Mudoka, there are only 2 requests. One is speaking, the other one is you. So there are no others. Sid.
Thank you, Honorable Speaker. Thank you, Honorable Speaker. Of course, I have been ignoring some of the noise, Honorable Speaker.
There is no noise.
That's why I am addressing the Speaker all the time.
You are out of order.
Thank you, Honorable Speaker. Honorable Speaker, we had a sitting with Dr. Laiposha for members of the Assembly from Kibwezi areas. And I happen to have gone to that meeting. And even before that meeting, we had our own personal experiences on how we can help the people. That is where the Mutula card ideas came from, Honorable Speaker. He was telling us how if you have a 10,000 bill from SHA and we paid 3,000 shillings for you, the moment they get the rebate, the hospital gets the 10,000 shillings, they will get the 3,000, which we paid for you earlier, before you were admitted into the hospital. Then that way, that kitty will still be replenished. It will not be like our ward kitty where we have to put budgets all the time. This time, this 3 million will be able to pay forever, Honorable Speaker, until we change the governments. Because in 2027, Kalonzo Musyoka will change SHA and SHIF to other things, Honorable Speaker. You see now, they are up and running. And I can see Honorable Member for Ngumo is really happy when I mention his party leader, which is the same with others. And I can also see the Speaker. The Speaker is now smiling because he knows the stakes. Thank you, Honorable Speaker. I wish members will give a big yes. And as we give the big yes, Honorable Speaker, I expect the chair to also guide us and also speak to his department so that we can have those issues analyzed and also given a good position by the County Executive Committee member for Health. Thank you, Honorable Speaker, and I thank Honorable Mbalo and his committee, which I served previously before the majority leader came through back door and he threw me under the bus. Thank you, Honorable Speaker.
Leader of the majority.
You know, this leader of minority is a very interesting character. Mr. Speaker, sir, I stand to support this motion. Given that the essence of a government is to care for its citizens. And I think this has been very critical to the government in power through His Excellency, Mutula Kalonzo Jr. I have listened to the report very keenly and very strongly. It has captured key areas like sensitization, where people need to be sensitized on how to use this particular Mutula Care Card. It has also talked about issues of recruitment where fairness has been highly emphasized and openness. When you look at the arrangement, the whole layout, even though the layout is actively capturing what we can say fair democracy of the people. However, Mr. Speaker, I have a few key things which I would wish they can be put into consideration. One of the mishaps of this Mutula Care is the fact that we have an assumption that if we get the vulnerable people and we give them the cards, they will end up being admitted in the hospital. Mr. Speaker, sir, we have vulnerable people who have never stepped in the hospital for inpatient for a whole year. But they go to the hospital only to pick medicine and they go back home. That means if we give them this card, expecting that we are going to get the reimbursement of the share, we will get zero. Why? Because the cards will be lying at home. Let me quote this. One of the ward MCAs who has succeeded in sustaining his people through support of health or through the ward allocation is Zakika, led by the honorable member sitting next to me, Francis Motuko. And when I looked at it, I've also tried to apply the same kind of methodology. Other members have also applied it across board. And the Honorable Speaker, what happens is very clear, that we allocate money, but we have actually vetting done by the social office, that before they are supported by our kids, you have to write a letter to the social office to identify this as somebody who is coming from your ward. And that means at the point of inpatient intaking, that person becomes a beneficiary. Nobody plans to be sick. Nobody plans to go to the hospital. Nobody knows what time the sickness is going to strike. But we cannot ride on the assumption that we are going to give somebody a card, stay with it because they have a terminal disease, expecting them to go to the hospital. Why am I saying this? This formula needs to be adjusted so that it becomes a non-set kind of formula, whereby you only deal with the people who are likely or who are at the door of the hospital for admission. That way, it means we are working smart. That means we are actualizing on the details of those who are getting admitted. The Speaker, there's a lot of noise coming from the opposite end. I wish you could protect me. I do my submission and sit down.
Order.
It's unfortunate that the leader of minority, when he was doing that submission,
Leader of minority. Honorable Kalunda.
This is Arungasia. This is yes.
Honorable Kalunda.
We don't expect this from a leader of minority, Mr. Speaker, sir.
Yes.
He contributed, we were listening.
He needs to... member for Lima. You can't present a case to me and execute it yourself.
Okay, I leave it to you.
Honorable Kalunda, I called on you more than 3 times. You didn't hear, but some member from Masongalene and Tange listened. I would have allowed you to continue on consultations, but you defied. I only wanted to tell you to consult on Lawton, which you defied. Take your seat, please. Please take your seat. Proceed.
So, Mr. Speaker, it's good that at least he has listened, but I think what goes around comes around. And it's good for the leader of minority to know that when we are listening to him, it's not because that is a good speaker. We are listening to him because we are bound by the ethics of this house. He should also abide by the ethics of this house. Mr. Speaker,
proceed.
Mr. Speaker, sir, so in this context, I was saying that I would wish to request the chair, the able chair, who has come up with very good guidelines, well actually refined guidelines, that they may consider the onset of this particular program, so that we do not have a futile program which is messed up by the onset or by the entry point. Once we capture it right from the word go, the rest of the things will flow, and this will become now a revamp for our own health sector in this particular count. The Speaker, sir, one of the key things I've also looked at is the issue of the referrals. The Speaker, there is a kind of cartel within the the county government hospitals, and I would wish the chair can investigate this, that most of the people, or most of the professionals, some of them, are conniving with the other institutions outside Makueni. And you find somebody at the far end of Makindu is being referred to as service in Machakos, yet that service can be found in Makueni. When you fall into the details, you find there's a bit of conniving, that there's a bit of, it's like a cartel, that I'm going to send this person to you, charge this much, how come to come and take my tech? Mr. Speaker, this should not happen. And I would wish to urge our professionals within Makueni County that let us serve the people within due diligence without necessarily looking at the issue of what are you benefiting, or are you forming a kind of a cycle where you become actually the controller of the cycle. That way, it means this is a successful exercise and it can take us to the next level in terms of health. Thank you, Mr. Speaker, sir. I wish to urge the members to support this motion because it is a viable motion, very important motion to our vulnerables and also to our citizens who happen to fall sick. Thank you.
Minority Whip.
Thank you, Mr. Speaker. Mr. Speaker, I stand to support the motion. And I have only 3 things to put across, Mr. Speaker, which I think to me, they are very critical. One, Mr. Speaker, one of the recommendations of the committee, of which I want to appreciate the good work the committee has done, is that for people to benefit and to understand the Makueni universal health coverage, there is that need of sensitization and awareness. And this calls for 2 departments to work together closely and give synergy to each other. One is the Department of Health, and the other one is the Department of Devolution. Because, Mr. Speaker, when we have other awareness creations on other matters in the wards, we don't see an effort that is meant through the departments that the people can benefit with the information. Therefore, Mr. Speaker, it is very important because we have the units, the cluster units, that are very key on the levels of administration, that the awareness creation can start from those cluster levels. And it's also very important that, Mr. Speaker, when those departments are doing that, they make an effort to collaborate with the national government, where the office of the chief, they are also involved. Because, Mr. Speaker, for us now to identify those people who are challenged, we may not have information per se, 100%. But from those officers, the information is also there. Remember, I want to remind this House, Mr. Speaker, when you are taking data for PWDs, some of the citizens in Makueni did not benefit. Why? Because, Mr. Speaker, there was a document that was very important, but those people were lacking those documents, the national ID. And you cannot benefit by filling those forms and also benefit from the healthy facilities when you do not have an ID. And Mr. Speaker, for those we can say they are physically challenged, you'll find that most of them, they are above 18 years. But you find they are not able to benefit because that critical document is lacking, which I think to me, it is also important that we have another level of collaboration between the county government department and also the national government when it comes to the issues of getting IDs, which I think to me it is very important. Number two, Mr. Speaker, allow me to appreciate the committee because when I went through the document, it was very clear that the coordinator who actually did not have a skill on what needs to be done on matters of health, but they saw it as a gap. And when we were doing those public participation, it also came out strongly with the members of the public. Therefore, I see it resonating well with this House and also the members of the public. Therefore, Mr. Speaker, that is an area that I want to commend a good job that has been done by the committee. Finally, let's take it now, we, the Assembly, as a task on our side. When we got into each new financial year, we may lack donors, we may fail to get some private injections from other quarters, but we get to understand that when we inject a budget, then we are going to help the department to achieve. And this program, I can assure you, Mr. Speaker, with the commitment of the Assembly, through the department, then I can see giving a benefit to our people, and at large, the people of Makueni benefit. That is what I want to say, Mr. Speaker, but I cannot forget to say the idea of Makueni, Mutula Kilonzo Jr., for seeing it wise for his people to benefit and for his people to get.
Mr. Speaker, we all understand the poverty level of our county, and Mr. Speaker, these guidelines will uplift our people to a standard whereby they can access medical care. Mr. Speaker, the guidelines promote consistent, high-quality clinical practices, streamline emergency response and referral systems, and reinforce transparency and accountability in the use of health resources. Mr. Speaker, we are all looking at how we can account and be transparent on our account resources, Mr. Speaker. These guidelines have taken care of that. And Mr. Speaker, in addition, they prioritize preventive health measures, uphold patient rights and dignity, and they provide target support for vulnerable populations. Mr. Speaker, I am here to speak for the rights and to voice the needs of the vulnerable groups, Mr. Speaker, and they are taken care in this guideline. Collectively, Mr. Speaker, this guideline contribute for a more efficient, ethical, and a patient-centered healthcare system. Thank you, Mr. Speaker. I support the motion.
Member for Nzawi, Kalamba Ward.
Thank you, Mr. Speaker. Mr. Speaker, I rise to support the motion. Mr. Speaker, there's something that I've heard from some of our members saying that actually we should pay when we are sick. Insurance all over the world is paid before you get sick. Even the local chamas, the funeral associations within our communities, you don't pay when you are about to die. You pay knowing that one day you'll get into a problem. So, Mr. Speaker, we may not avoid that. Mr. Speaker, just protect me. The member for Ilima is disturbing me. So, Mr. Speaker, Mr. Speaker, my feeling is that
since you wish to be informed by Honorable Galuna?
No, Mr. Speaker, definitely no. Which house?
What is it, Honorable Galuna?
Thank you, Honorable Speaker. You see, Honorable also is my senior.
What is your point of information?
Honorable Speaker, Honorable Musso has indicated that insurances must be paid prior to being sick. That is why we are not calling SHA Mutula Care as an insurance cover. We are calling it just as a scheme. It's a healthcare scheme, Honorable Speaker. And that's why I'm able to pay for somebody when he is sick, ready in the bed, in the hospital bed, Honorable Speaker, and I can pay for them the shisha, the shift, I don't know the name, the shisha thing, Honorable Speaker, and they are treated using the same, Honorable Speaker. I'm not disputing what he's saying, but the practical thing with this shisha, Honorable Speaker, is very simple. It's a scheme where they have allowed people to pay when you are sick. And that's why maybe it is not well managed. And that's why maybe, Honorable Speaker, they are not able to pay for some of the medication.
Your information.
They are not able to pay for some implants, Honorable Speaker.
Don't
that is
take
it.
advantage of
That's what
information
we are
to
saying,
debate.
Honorable Speaker. And
Information.
my friend, Honorable Muso, should
Very
learn
well.
from the...
Member for Elima.
Now, given that we are on air, I wouldn't wish this wrong information, Mr. Speaker, to go out there. I would wish to inform the honorable member that Mutula Care is not an insurance care. This is not an insurance scheme. It kills the program. Thank you, Mr. Speaker. I believe he is informed.
Member for Nzawi Kalamba.
I can tell you, Mr. Speaker, without any fear of contradiction, that they are saying, what those two members are saying is none of my business. Because, Mr. Speaker, this is an insurance scheme as far as I'm concerned. Because Mutula Care, we are collaborating with SHIF and SHA. So this is an insurance scheme that we are getting into. So you cannot say you are going to pay for only those people who get sick and go to hospital, Mr. Speaker. It will amount to something that we do not even know. Mr. Speaker, that is why, in the first place, we went through the guidelines. We went for public participation, and we agreed with the residents of Makueni that we should pay for them before they get sick. If you don't get sick, for example, Mr. Speaker, let me just pick another example. We insure vehicles. Mr. Speaker, we...
Proceed, member for Nzawi Kalamba.
Mr. Speaker, we insure vehicles so that in the event that you have a problem, you are paid or you are compensated. So, Mr. Speaker, I'm differing completely with these members because I know we are getting into an insurance scheme, Mr. Speaker. So we should move, knowing that we are moving to an insurance scheme called SHA or SHIF, Mr. Speaker. That's my assertion. What point of order?
Member for Thanke Ward.
Thank you, Honorable Speaker. Honorable Speaker, I stand to support. Honorable Speaker, I want to join my colleagues, Honorable Speaker, on expounding on this this issue, Honorable Speaker. Honorable Speaker, it's good what Mheshimiwa Bishop and Kalonda, they are saying that we need to be paying once a patient is in the hospital. But Honorable Speaker, you know, I and all of us, we know how requisitions are done. You cannot, what we used to do, Honorable Speaker, because I also had the kitty, which Mheshimiwa Muso and Kalonda have, we were just doing letters and then the money was paid later. The only problem now, Mheshimiwa Bishop, is that you cannot do requisition when somebody is in the hospital at that time. That is only the problem, Honorable Speaker. But what they are saying, it is very important, Honorable Speaker, because you find that level 1, 2, and 3, we are not getting anything from the ground, Honorable Speaker. And most of the people whom we are paying for them, they are in that card, Honorable Speaker. But having said that, Honorable Speaker, because we cannot do requisition on time, because we have to do requisitions, we present papers, they are being approved. Before all those papers, Mr. Speaker, have been approved, that person will already have died, Honorable Speaker. So, Honorable Speaker, okay. Let him inform him.
Honorable Kalonda, don't take advantage of your seat
thank you,
to
Honorable Speaker. I
intimidate
don't
your
want to
members.
debate. Yeah.
To intimidate
I
your
want to
members,
inform.
to inform them.
No, I want to inform.
Okay.
You know, they are my friends. And you know, Katumo, we come from the same region. We come from the same region with
Okay, inform.
Honorable Speaker, what we are saying is very simple.
Honorable Katumo has a very
You wish to inform Honorable Katumo?
Honorable Katumo and the House, eh?
No. I gave you an opportunity to inform
Okay,
Honorable Katumo.
I want to inform Honorable Katumo, which he has obliged, Honorable Speaker. Now, we are saying the chief officer should have the float. Like the 90 million shillings should be in his coffers, Honorable Speaker, within his reach, Honorable Speaker, distributed across the level 4 hospitals, Honorable Speaker. So the moment, we are only saying, the moment somebody wants that service, the Shisha service, Honorable Speaker, there should be a dedicated staff to pay up that insurance scheme for that person, Honorable Speaker. That is what we are saying. Honorable Katumo has a very good point. Like he's saying, that somebody will die as they organize for the money. Now this assembly is here to task the CEO, the chief officer. The chief officer is an accounting officer, Honorable Speaker. We are saying the Minister for Finance, the chief officer, should conveniently find for this money without waiting for them to be given after the whole year, Honorable Speaker. Find the money, avail them in a float somewhere, so that when somebody visits Ndongoni sub-county hospital in Ivingoni, Honorable Speaker, it is paid up immediately, and then it kicks off. When somebody else visits Tawa sub-county hospital, Honorable Speaker, the chief officer has a dedicated officer to send the money directly to SHA, then the process kicks in. We are saying this process should not wait until when the money is available. It should be availed immediately. We stop other things. It should be availed. When it is there, that is when now the chief officer is able to pay up for those people who are going to be admitted. Otherwise, Honorable Speaker, I said, we will have a whole lot of all people we have covered, but none of them will get to the hospital and be admitted. And that way, the county government of Makueni will lose 95 million shillings. We'll lose 95 million shillings. But when we get this money,
we'll lose to who?
We'll lose to government. We'll lose to SHA. We'll lose to SHA. Because the SHA, you know, Honorable Speaker, the design of SHA is not like what Honorable Muso is saying. The design of SHA is very simple. When I pay, that is the time I will get into the system. So now, other than us paying, then somebody staying for a whole year without going to the hospital and being admitted, Honorable Speaker, why don't we avail the money? The person who is going to be admitted is the person who will qualify for this money, Honorable Speaker. That is what we are saying. Otherwise, Honorable Speaker, will pay for 18,000 shillings, as Honorable Mbalo has told us, Honorable Speaker, 18,000 homesteads, Honorable Speaker. Then all of them will not go to hospital. So that means we will not even get money now to replenish the kit, which the 90 million shillings is now taking full effect, Honorable Speaker. That is what we are saying.
Fair enough.
Thank you, Honorable Speaker. And Honorable Katumo is very
Honorable Katumo, proceed.
Is informed. Now change a bit. Thank you, Honorable Speaker.
Thank you, Honorable Speaker. Honorable Speaker, you have been a waziri and a chief of staff. You have been in these corridors for some time, Honorable Speaker. If what Mheshimiwa Karunda is saying, it can happen, Honorable Speaker, then I'll go with his way. Because, Honorable Speaker, look at this, Honorable Speaker. In my ward, we have 600 people who are going to pay for Themotula care. And now it happens that in that year, only 100 visit level 4 and above. 500, they have not visited. It means that, Honorable Speaker, the national government will have gone with amount worthy for 500 times 6,000. That is a lot of money, Honorable Speaker, from my ward. If, Honorable Speaker, from where you sit now, you advise us that that kitty can be ready. Because, Honorable Speaker, we will also have some committees who will determine if this person comes from the Thanka ward, Kadonzweni, you see those things. Honorable Speaker, if that can happen, then, Honorable Speaker, if that can happen, Honorable Mheshimiwa Muso, cool down. You will have your time. Honorable Speaker, from where I sit, if we can have that kitty, Honorable Speaker, ready, then, Honorable Speaker, that will be the best way. We pay for those who have chronic diseases, who visit the hospitals on a level. And then the other monies be kept in that fund. If it is possible, Honorable Speaker, then that is the best way to go. But if it is not possible, Honorable Speaker, because of the requisition issues, then, Honorable Speaker, you need to, no, don't inform me. I'm well informed. Thank you, Honorable Speaker. Thank you.
Mover of, before we go to the move of the motion, Honorable Manzu has been listening to you, Leader Majority. You also as a point, Honorable Manzu, member for Masongaleni. That's all. Proceed, Honorable Manzu, followed by Masongaleni.
Thank you, Mr. Speaker, for this opportunity. And I would standing in support of the motion. And I am worried if some members went to the public participation, because these guidelines were subjected to public participation, and the many good opinions and views they have are not captured in our report. And there are things that we spoke to our people, and they are the people who came with these views. They are experts who came up with this plan. If at all we are going to come up with another proposal and another kitty, I think their proposals can be captured. I would also like to remind our people that let's stop behaving like when we pay monies to share and shift, it's like we are losing. In my ward, for example, I don't have any it is a 4. I don't know how to put it. An hospital that is level 4. And it doesn't mean my people don't get benefits when they visit the dispensaries, the level 2 and level 3 hospitals. So I would like to remind the honorable members that we also benefit through SHA in level 3 because the services there are free. So what we should do is go with the guidelines which have been captured, and then if we see some gaps, because this card is the Makueni care, it's something that we are starting. Those gaps can be handled and dealt with in the coming years. So, Mr. Speaker, I support and I urge members to support this, and we do away with these many proposals. They will mislead us. Thank you, Mr. Speaker.
For Mazongaleni Road.
Thank you, Honorable Speaker. I stand to support this motion, Mr. Speaker, but I wish to make some few comments, Mr. Speaker, on the same. Honorable Speaker, I think the bone of contention in this discussion, Mr. Speaker, is on the identification of who is supposed to benefit and when. Honorable Speaker has announced that he is mandated to conduct oversight on expenditure across Makueni County, Mr. Speaker. I think we should be very careful on how this is carried out, Mr. Speaker, because we should not be excited, Mr. Speaker, on doing registration en masse when majority of these people, Mr. Speaker, that will be put on this scheme, Mr. Speaker, might not benefit to get treatment at a level 4 hospital, Mr. Speaker. Hence, the government losing big time, Mr. Speaker, because on the category of who is supposed to benefit, if we pick someone and enroll them to the system and probably spend over a year without getting to a level 4 hospital, Mr. Speaker, those premiums will have been spent for nothing, Mr. Speaker. So I support the idea by the minority leader and a couple of members, Mr. Speaker, that if we could consider having the kitty on standby, so that when someone gets to the hospital, that is level 4 and above, they are onboarded immediately before admission. That way, Mr. Speaker, we'll be able to recoup the money spent by the government, Mr. Speaker. Honorable Bishop will never allow members to contribute without...
No, I'm the one who was called the leader of the majority, not leader of majority. When you come to consult the speaker,
I'm addressing the chair,
you
Honorable
release
Bishop.
your hands. Don't throw your hands. You just come down.
But he's provoking.
He's provoking Honorable Bishop, not leader of majority. So now how to differentiate the two?
And I'm addressing the chair, Honorable Speaker. And he resigned from the responsibilities of being a chair.
Proceed.
Thank you, Honorable Speaker. The Honorable Member is addressing me as Angulia, and I'm very proud to be called one because I'm a proud Angulia. So, Honorable Speaker, as I close, I was saying if we could consider to have the kitty on standby, and as advised by the Honorable Member for Thangaward, Mr. Speaker, you have experience on our government, on our government's run. You've been a chief officer, you've been a waziri, Mr. Speaker, and you can also offer guidance to the government on how better we can have the investment of 95 million by the government of Makueni County spent and utilized wisely in a manner that will be able to get that money back to help the people of Makueni County, Mr. Speaker. Because if I invest 3 million, Mr. Speaker, for Masongaleni ward, which would have been meant to address other emerging issues, Mr. Speaker, and never get this money back, I don't think that would be wise investment, Mr. Speaker. So, as I support, I advise that we are open to more ideas on how better we can have the scheme.
Robumbalo, on Lawton.
We can have the scheme working. As I consult, I have concluded my remarks, Mr. Speaker, and I thank you.
Mover of the motion.
Mr. Speaker, thank you, Mr. Speaker. Mr. Speaker, I want to make a few comments here for members to hear. We have been urging people to be registered in SHA because even those who have not paid, in level 1, 2, 3, they attend and we get reimbursement. We don't lose anything. But Mr. Speaker, we have among the community, people who have been incurring a lot of cases whereby we have chronic burden, disease burden that is weighing heavily on our people. Within the registration, we were taken through this, and we realized those who have chronic diseases are given points higher than others. So we'll be able to fish them and weight them. There is no way, Mr. Speaker, we can go to register, we can go to talk of having an insurance without targeting specific people. That's why in Makueni we are targeting the vulnerable, and the vulnerable must be known. It is not possible to wait. No insurance will accept that, Mr. Speaker. So, Mr. Speaker, members, I'm requesting you it can't. Kidding amendment is it can't. You see, you don't get it. It can't. Mr. Speaker, I'm waiting to address once you're through. It's a political tool.
Mover of the motion. Mover of the motion. Mover of the motion.
Parliament took us, the committee, through a system which was able to show how they'll be able to filter the vulnerable. The people who are living with the disease burden, the people who need dialysis, others diabetes treatment, others are chronic cases carrier. They'll be able to be fished through that. So, Mr. Speaker, I urge members, since we have been heard this, I request, Mr. Speaker, that we put the question and we support it as it is. Thank you.
Honorable members, I now put the question. Clerk, do we have a quorum? At least one member. The member is not outside, is within the chamber. Toilet facilities and washrooms are part of chamber. We fish him. We have quorum. The member is still within. Honorable members, I now put the question that this assembly adopt the report of the Committee on Health Services on the Macquarie County Universal Healthcare Coverage Implementation Guidelines to year 2025. Step in. Honorable members, I now put the question that this assembly adopt the report of the Committee on Health Services on the Macquarie County Universal Healthcare Coverage Implementation Guidelines of the year 2025 laid on the table of the Assembly on 2nd of December year 2025. Will as many as of their opinion say aye? Aye. Will as many as of a contrary opinion say nay? Nay. The ayes have it, only one nay. I thought nays were many. Now, honorable members, I take note of that this policy was subjected to public participation, in which all of you participated. And I presume your views were taken by the committee, and those views are part of this report. Now, if you read page 8 of it, of the policy refers to that the policy is designed in advance realization of the universal healthcare coverage for residents of Macquarie County by progressing the paying of SHIF for 18,000, paying of SHIF for 18,000 indigents and vulnerable households in the first phase, and also mobilization of the whole population to register to SHA while educating residents of the benefits of SHA. As at September 2025, SHA registration coverage in Macquarie County stood at 34%. Through this implementation of Macquarie UHC, the county government's aid at achieving 50% enrollment. Now that is the policy that was before us. Now, legislation is not static. We are the legislators. If for whatever reason you feel that there is a clause in these regulations and you feel that it should be amended, all you need is to introduce that, propose that amendment, or by way of a concern raised with the committee, and the committee should be open. And even before implementation, take into consideration of the views that Honorable Mudoka, Member Fonzo Kile Kalamba, there are good reasons that they are taken care of before implementation. And we are always, and we can always be available either to show some clauses or immediately convene and review that clause or amend it. So I think that serves the concerns of the members. So engage the executive and the citizens and others so that we continue to shape this policy from good to better to best. But we must start from somewhere. Chairperson Committee on Health, don't take for granted the views expressed by members because legislation evolves every minute and there are new ideas. So take note of those issues, invite the executive committee members, and particularly the members who had raised the said issues, to have a word and listen to them so that their concerns are meant to better the policy from its current state. And therefore direct that the clerk of the county assembly communicate this policy for implementation to the county executive committee member for finance, the county secretary, and a copy to the governor. Honorable members, time now being 17:00 hours. What? Honorable members, the motion for adjournment of this floor was approved in a calendar. We approved it. Now, that motion ordinarily is ceremonial. So in the interest of time, we are already adjourned. But should you want me to sit, I can still sit. We talk about the adjournment. No, take note. What I'm trying to say, what we can't do now is to vote. But I can resume my seat. Take your seat, honorable members. Take your seat, leader of majority and leader of minority. Before the house rises, it is important for, just take your seat, take your seat. What bars has from conducting business from 5 is taking a decision that is making a decision. Now this motion is ceremonial and as a matter of fact, nothing stops you from reading the motion and it is supported and we adjourn ceremoniously. That is it. So proceed, clerk, read the next order.
Order number 45, procedural motion. Adjournment of the assembly in accordance with the county assembly calendar, regular sessions 2025.
Mover of the motion, leader of the majority party.
Thank you, Mr. Speaker, sir. I beg to move the following procedural motion that that pursuant to the standing order number 31, subsection 3, the assembly adjourns from today, Wednesday, 3rd December 2025, until Monday, 9th February 2026, in accordance with the county assembly's calendar regulations 2025. I call upon the minority leader to second the motion.
Honorable members, I propose a motion that pursuant to standing order number 31, paragraph 3, this assembly adjourns from today, Wednesday, 3rd of December, until Monday, 9th of February 2026, in accordance with the county assembly calendar regular sessions of the year 2025. The floor is open. Member for Muka.
Honorable Speaker, I wanted to contribute and say that that motion doesn't want us to stay here. Honestly, we should have adjourned because it's not procedural. We are closing today. It was passed by the assembly. The calendar was read here. It is not necessary for us to be here. Thank you.
Thank you, Honorable Speaker. Honorable Speaker, this assembly determines the sittings. This assembly doesn't wait for somebody else to decide for them when they can sit. And that's why the leader of majority is able to move a motion to ask us to consider more business. Maybe they are government businesses. Like I understand, ADP is not ready yet, and it was not moved this afternoon, Honorable Speaker. And that's why we're coming here to help the people of Makueni. People may sit out. Like today, we are 48 members, but 16 members have been sitting here since 2:30, Honorable Speaker. That tells you something. It is a choice for you to come or not. It is a choice for everybody, every member here. We were so near. The day we were so near, Honorable Speaker, all of us were here because we wanted to get that recognition and identity to be members of the assembly. The same way we were so near on 21st of September 2022, Honorable Speaker, is the same way we will be coming here on Monday to make sure we pass the ADP, Honorable Speaker. We are not coming here to laugh about it here, Honorable Speaker. We're coming here to help the people of Makueni to get the documents which are needed, Honorable Speaker. And that's why I stand to support this motion. I know other members want to show that it is not practical, but we can do it on Monday, and that's fine. Thank you, Honorable Speaker, and I wish members would give a big yes so that we come here, we do the ADP, and we do our things. Thank you, Honorable Speaker. And,
Majority Whip.
I know people want to sabotage the business of the government, Honorable Speaker. I know, Honorable Speaker. Honorable Speaker, allow me to finish, Honorable Speaker, because I requested and nobody else wanted to have the mic, Honorable Speaker.
Please conclude.
I understand, Honorable Speaker, members have been instructed to come here and sabotage the business of the assembly.
Majority Whip.
Thank you, Honorable Speaker. Thank you. Thank you, Honorable Speaker. Unlike the leader of the minority party, I stand here to wish members a very good holiday, that now we are breaking from December to February. And you know, it's a moment to stay with family and celebrate Christmas and other occasions. I stand on behalf of the leadership of the majority party to wish this assembly a very great holiday and recess ahead. Thank you.
Thank you.
Honorable Majority Whip, you got the reason. You got the spirit as to why I've asked members to sit. That is it. I mean, proceed.
Thank you, Mr. Speaker. Mr. Speaker, I want to make a comment judging from what members around the mood and whatever, because majority of members seems to be of opinion that a special sitting be called later. Because we must agree on way forward. When the budget committee will have been ready, meet the CS finance, the ECM finance, and once they are through, then Mr. Speaker, you can call a day's meeting upfront where we can be able to come and pass, because that seems to be what I'm seeing majority of members are thinking of. That is my point. Thank you.
Very well, the leadership and the House business, the chairperson, budget and appropriation committee will consult and advise members within the official and formal platform. Honorable Misha Kali.
Thank you, Mr. Speaker.
Make it short.
Yes. Mr. Speaker, we have one business.
Mafungumo, you are next.
Thank you, Mr. Speaker. Mr. Speaker, we have one business that is very important, but as we consider to have a special sitting, there was a banning statement that also came on the floor of this House, and that concerns the teachers, the ECD teachers. And Mr. Speaker, I remember on Monday, in the evening session, the speaker who was on the chair guided that today we get a response, of which after we had a few discussions, many calls came to us. That reminded me that on Monday, the session that we had was on YouTube. Therefore, the members of the public were able to follow. And today, they were actually on alert. Management statement that also came on the floor of this House. Thank you, Mr. Speaker.
This is Honorable Mwikali.
Thank you so much, Mr. Speaker, sir. Mr. Speaker, I support that motion, and I would request you to guide this House on how we are going to conduct our committee sittings after we adjourn today. Thank you so much, Mr. Speaker, sir.
Thank
No,
you.
minority.
Thank you, Honorable Speaker. Honorable Speaker, I didn't want, I don't need to wish people Christmas because Christmas is not coming next week. We have more than 3 weeks to Christmas, Honorable Speaker, and we must be very serious with the business of this assembly.
Okay.
Honorable Speaker, I have a very burning business from the Committee on Water. That's why Honorable Leader of Majority is also well versed with the requirements for next week, Honorable Speaker, because we have a burning issue to do with close to 10 wards, Honorable Speaker, where Kimoasco woke up and emphatically increased water tariff, Honorable Speaker, without consulting. And the same had happened in 2018, and we pushed them to the wall until they accepted the correct tariff, Honorable Speaker. I expected, because next week when we come back here on Monday, Tuesday, and Wednesday, some day next week, Honorable Speaker, and we'll be closing for like 2 months, Honorable Speaker. I wished members you could allow, we sit from next week for 2 days or 1 day, Honorable Speaker. Then when we sit, we consider the ADP, we consider the teachers,
Order,
we
Member
consider
Fanzawi.
the
Take
water
your seat.
tariff, Honorable Speaker.
Take your seat.
And it's very important, Honorable Speaker. It's very important, Honorable Speaker, for us to
We
have
will,
that. Honorable Speaker, I know,
Leader of minority.
when it comes to, I want to finish. I am addressing the Speaker.
Order, honorable members. Honorable members, we are on an adjournment motion, and it's a ceremonial motion. Now, the business ended at 5, but I've gone further to extend this ceremonial debate so that then you don't adjourn and resume on February without making any remarks that is relevant to this motion. I'm afraid, Honorable Kalunda, unless it is on 9th of February, no other motion can go through to deal with that matter. If there will be a reason for us to be convened, the leader of the majority and the leader of the minority can move the speaker and that business will be considered. For now, a leader of the majority and any other member, and then therefore, please, let's leave it at that. I know you may be dissatisfied with the outcome, but it's part of debate. So don't take us to amending. We are adjourning and we are on remarks. If you've not. Now, the last one is Member for Thank. Please.
Thank you, Honorable Speaker. Honorable Speaker, if my minority leader is not going to move that motion, that we're not going to pursue you, I will do it, Honorable Speaker, because Honorable Speaker, Honorable Speaker, I have a statement. Honorable Speaker, I have a statement which I wished it would have come next week on Monday. Honorable Speaker, Kibwezi Amref, and I quote, minyonye watoto inabebwa na baboons, Honorable Speaker. Honorable Speaker, niko na nyani wengi sana in that hospital. Zile zinatembea hapo, zinabebwa, you get that case? Honorable Speaker, I have a very serious case with monkeys in Kibwezi Amref Hospital. Bring what? One of the doctors broke his leg. Yes, Honorable Speaker, in fact, they are carrying babies, what do you call them? Babies what? Feeding bottles, Honorable Speaker. It is a very serious issue, Honorable Speaker. So if my leader is not going to do it, Honorable Speaker, I will come to your office. I will convince you, Honorable Speaker, we have a special sitting. Otherwise, in case, Honorable Speaker, if you will not be convinced, I want to wish you Merry Christmas and Happy New Year 2027. Thank you. 2026, sorry. Thank you.
Thank you, Mr. Speaker. It's very amusing, honest, to be in this house.
We are rising. It's such occasions are rare.
I want to take this opportunity
We are rising.
to thank all the members
Honorable Elizabeth Mutindi, your leader is on his feet to speak on your behalf.
for the sessions which we have had. It has been a nice time of interaction, Mr. Speaker, sir. We've enjoyed being together, despite the fact that we had lost one of our members quite a number of time. But I'm taking this opportunity to wish all members Merry Christmas and a Happy New Year, and actually happy season and festive moments with their families, with their churches. And let us keep safe. Let us keep in prayer for the sake of one another. That said and done, Mr. Speaker, I also wish to take the same route that I believe we will need to consult further as concerns the issue of the ADP and the so-said serious business, so that we can see which day we can be able to reconvene and handle this matter. but officially and formally, we can be able to agree along the line. I wish you well, members. Thank you for the support.
What is it, Mwalimu? Honorable. I thought you were leaving.
I might as well say something. Today is World International Disability Day, which
You
the
represented me.
majority leader seems not to have an idea about. It is a day that the people living with disability amongst us celebrate their achievements and their abilities, their different abilities. So we celebrated today at Kenya Prisons grounds opposite Makueni Boys, and it was a colorful event. And I want to thank the office for the support accorded to me as the chair who represented the speaker. And I wish to urge members, let us go home and take care of our disability, our people living with disability and other vulnerable members of our community. Let us not assume the role that God has bestowed upon us, so that we should always give a helping hand whenever we are required during this recess. Thank you, Honorable Speaker.
Honorable members, I wish to extend my Christmas wishes to all you, honorable members of the County Assembly of Makueni. May this festive season bring you renewal, unity in serving the people of Makueni with integrity and dedication. Merry Christmas to you all and the citizens that you represent. Time now being 17:23 hours. This house stands adjourned until Monday, 9th of February, year 2026 at 14:30.